Hi, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about a multidisciplinary team approach, which involves dental treatment by a number of dental specialists in our office. Today we're going to talk about our patient Melinda, who presented to our office in her early 40s. Melinda required a multidisciplinary team approach for the treatment of a number of complex dental issues. Melinda's treatment started with a gum health or periodontal examination, and she had periodontal treatment to stabilize her gum health before starting her orthodontic treatment. You can see on Melinda's photographs and x-rays that she had a significant amount of overcrowding, particularly at the front of her mouth, and her two upper canine teeth were considerably out of position, which you would describe as ectopic canines. Melinda was missing a molar tooth in the bottom left side as well as the upper right side. Once Melinda's gum health had been stabilized with our periodontist, she then commenced orthodontic treatment with conventional train track braces. Due to the position of her upper canine teeth, it was decided to remove them, and we then use orthodontic treatment to align the rest of her upper and eventually her lower teeth. During her orthodontic treatment, Melinda initially had a dental implant placed in the bottom left side. You can see on her OPG x-ray that Melinda's maxillary or cheekbone air sinus was too large to allow for the immediate placement of an implant on the upper right side. To allow for this, Melinda had a minimally invasive procedure called a sinus lift, where artificial bone was positioned underneath the lining of her air sinus. This bone was then allowed to heal for approximately 6 months, and at this point it was possible to place dental implant in the upper right area. Temporary crowns have been used on both implants, and we've also attached brackets or part of her brace to these temporary crowns. This allows us to align the adjacent teeth into exactly the right position, creating the correct bite or occlusion around the implants. Towards the end of Melinda's orthodontic treatment, she then saw our restorative or aesthetic dentist. Final planning of the build-ups on her front teeth was carried out while her braces were still in position. This is done with a process called digital smile design, which allows us to position her front teeth in exactly the right place so that the aesthetic dentistry can make them look as natural as possible. You can see from Melinda's before and after photographs that there has been a significant improvement in Melinda's bite, in her dental aesthetics, and the overall appearance of her smile and facial appearance. And you can see at the end we have a very happy patient.